Well, howdy. Welcome to 2022. Here's to your good health. Happy New Year, everybody. It's so nice to be back. I told you that I would be out for a while after the holidays, and after, I guess I was on about the middle of November, and we had to take some time off and just rest and get back on track. So it's good to be back. I'm glad to be here. Me, myself, and I are your hosts tonight, so I hope you don't mind. I am live tonight. This is January 5th, 2022. And if you want to give us a call or give me a call at 407-1111, I'll talk about anything you want to talk about. It doesn't matter. If I don't know the answer, I'll find out and I'll let you know. So we're just going to talk about a couple of things. The Omicron virus, as I'm sure you've heard, is going full strength, and we're seeing a lot of people sick in the office, but I haven't seen too many positive. So I think there's a lot of different viruses out there. Might even be some flu, I don't know. We're still not testing much for flu, primarily for COVID. And like I said, for me personally and in our office, we haven't seen too much from the population outside. However, we've had an outbreak inside. So we've got people out, which is not a good thing, but they brought it in from, they had sick children at home. And so that's how that happened, because we try very hard to not let anybody in the door that has any kind of COVID symptoms, including our staff. But you don't feel bad and you come to work and you don't really think about that your little girl had a little runny nose or something, and then all of a sudden the little girl gets sick and mama brings her in and she's positive, mama gets tested, she's positive, and the nurse in the same area with her that's been coughing, she's positive. So it can spread quickly, but all this distancing and all this masking and all this precautions that we've taken, a lot of it hasn't really helped much. The main things to keep ourselves safe and to keep others safe is wash your hands. This is the stuff we've been talking about since I've been a nurse for 30 years, and I know it went way beyond that. But if you've got a cold or you don't feel well, don't go to work. And I know that employers don't want to hear that, but that's how it spreads. Just like this nurse, a couple of nurses at our office. And it wasn't intentional. It's just one came to work with a cough, didn't think much of it, but she ended up having COVID. So I think it's important that you wear your mask when you're mandated. I don't have a problem with that. I wear my mask at work every day, so that's not an issue for me. Wash your hands. If you're sick, stay home. Be careful, if you are coughing or sneezing, that you do cover your mouth if you don't have the mask, cough into your elbow like that. We just have to use common sense with all this too. I hope that they don't close schools and do all that, because obviously it didn't do any good. It didn't stop the virus from mutating. It didn't stop us from going from one variant of the Delta to another variant of the Omicron. And I've heard rumors of there's another one over in Africa. I don't have any positive facts on that, so but my point is, this is a virus, and that's what viruses do. We've had a common cold how many years? and we've never found a cure for that. We've had, the flu, influenza, multiple various kinds of influenza. There's no, you can get the flu shot, and that is about a 60% chance that will keep you safe from the flu. So there's still a 40% chance you could get the flu even with the immunization, and now we're finding out that with the COVID immunization, we're still getting sick. So I think it's just another variation of viruses that we've been dealing with forever and ever. There's 365 different viruses that cause a common cold. So I don't want to minimize it, but I don't want to enhance your fears either. I think we have to start living our lives and doing what we can do, and like I said, just be cautious and be careful and be cognizant of others. If you've got a little cough or something, you might want to get one of those home tests to make sure you don't have COVID. Anyway, enough of that. So we're going to talk, and this is, January is always fitness month, it's always eat healthy month, it's always go to exercise month, it's always I ate too much over the holidays, my labs were up, I've gained 5 pounds, and now I'm going to the gym. And all those are good ideas and good resolutions. Most folks stick with it, for a month or two, and then we go back to our old habits. So my goal here is to just, I don't want to use the word harping, but to just really encourage you to live a healthier lifestyle. We're not going to eradicate all of the illnesses, we're not going to eradicate the viruses, obviously, but we want to feel the best that we can be when we're up and out and moving and doing. I've got 8 grandkids, so I want to keep active for them, and I want to keep able to chase after them. I've got them from 23 to 5, and that 5-year-old, she'll keep you busy. So, and she's still the one that really wants to kind of hang with her. They call me Gigi. My husband is Daddy Bob. So the rest of them are getting old enough, they want to do their own thing and be with their own friends. And, then as they get to be teenagers, it's like, oh, God, not Gigi's house. That's just the natural progression of how people grow up. And it was that way with my kids. It's that way with my grandkids. And so anyway, back on to the fitness. So I saw this on a website, and I liked it. So I wanted to, some of the things that are good medicine for us, that are not pills that you ingest, but just good medicine. And sleep is medicine for us. Lack of sleep is I've got lack of sleep. Lack of sleep is linked to obesity, heart disease, stroke, cancer, dementia. And so our aim is for 7 to 8 hours a night. I don't usually sleep past 6 hours a night. I am not a good sleeper. I've tried every trick in the book other than taking sleeping pills, and I don't want to do that. So I don't know. I was really off my routine. The 15th of December, I had my gallbladder removed, and so that kind of put me back. I couldn't do what I normally wanted to do. So this week, I've gotten back up at 5:30 in the morning. I read my Bible, say my prayers, and then I go and I get on the elliptical that's in my covered porch. Excuse me, I'm so sorry. And I get on that for, 7 to 15 minutes, depending upon how much time I have. So that has helped increase my energy. It makes me feel better that when I do that. Wednesdays are always a long day for me. I don't usually go home after work, so I get here at 7:30 in the morning, and I had my hair cut after work. Then I just came here and ate my salad for supper, so I'm just ready to go nighty-night now. But anyway, sleep. I'm not a good sleeper. Haven't been. Even as a teenager, you know, when kids could sleep till 1, 2 in the afternoon, I couldn't. I've always been early to bed, early to rise. I like to be in my bed at 10 o'clock at night, and by 5:30 in the morning, I got to get up. I can't stay in the bed anymore. That's who I am. So anyway, sleep is medicine. If anybody has any good sleeping tips for me, let me know. Call me, 407-1111. I always like to hear what other people do. I think I've kind of got it down to a science for me now, but it's still not as good as it could be. So then our next medicine is exercise, and that helps your heart, mind, body by moving more throughout the day. You know, the journey of 1,000 miles starts with one step. And I've got a Fitbit, and that I set it for me to walk 6,000 steps a day. It's not hard for me to get 6,000 steps when I'm not working. But when I'm working, it is, because I get up and I leave my station, carry my computer, go into a room, talk to the patient, examine them, walk out of the room into my station, go into the next room. I only put in 4 or 5, 6 steps in between patients and all, so you know, you got to do a little bit more stepping than that. So when I'm home, I walk down to the dog pen, I walk over to the chicken pen, I see the goats. When it was so nice over the holidays, I did a lot of planting and digging, and you know, I love to dig in my garden, so then it was not hard to get the 6,000 steps. Today I'm at 4,500. So I might get to 5,000 before I go to bed. So exercise is medicine. Love is medicine. Show gratitude. Make time for family and friends. Practice mindfulness. You know, mindfulness is thinking about what we do. And I got to look up exactly what the definition of mindfulness is. And then we need to be kind to one another. You know, it is not hard to be kind. It is not hard to be kind to others. It's not hard to pass on kindness. You know, a smile. Hi, how are you? That's an act of kindness, and that's not a big deal. And then food is our medicine. You know, you don't need to follow the latest food diet or the latest fad diet. A whole food, plant-based diet is proven to improve every aspect of your health. In our family, we've got, you know, we go from one spectrum to the other. It was horrible at Christmas trying to make food for everybody. I've got a gluten-free vegan, no dairy, no anything. She will eat other things, but that's primarily her, that's my daughter, that's her diet. She had an elevated cholesterol. It was not high, super high cholesterol. It was not something that was going to cause her problems, but she decided that she didn't want to have that high cholesterol number, and so she made a point of eating a plant-based diet. She will eat chicken or something once in a while, especially if she comes to my house. She'll have, you know, a lot of vegetables and maybe a chicken wing or something, whatever I'm serving. Then her husband is what we call a pescatarian. He eats primarily vegetables, but he will eat fish. So we've got the gluten-free, we've got the vegan, we've got the pescatarian, then we've got grandkids that, you know, only want to eat hot dogs or only want to eat spaghetti or only want to eat macaroni and cheese. And then you've got the rest of us who will eat just about anything you put in front of us. So it gets to be a real challenge when you've got a lot of people over. I've kind of come to the conclusion that we're just going to have Christmas Eve at my house at 6:30, and everybody can eat before they come, and I'll serve coffee and dessert for those that want it. because I spent a lot of time on my feet. I've got 3 kids. I had one for Christmas Eve lunch, one for Christmas Eve dinner. Christmas Day, it was my husband and I. We went to the movies. That was fun. Then the next day after Christmas, my son and his girlfriend from Asheville came, and they were here 2 days. So I felt like I did nothing but stand in the kitchen, cook, clean. My poor dishwasher, I'm sure I probably run it more in the last 3 days than I have in the last month. But anyway, food is good. Plant-based is the best, I believe. I think we all eat too much meat. I think that the American diet is a poor diet. It's an unhealthy diet. I think that processed foods are the devil, so to speak. They're very unhealthy for us. And all of this food causes obesity, and all of this food causes diabetes, high blood pressure, high cholesterol, because we don't eat what God provided for us to eat. So that's kind of what I wanted to talk to you about as far as some of the medicines that we can take, which is sleep, exercise, love, and food. And I like all of those things, actually. I like to exercise. I've always liked to exercise. My body was made to move, and I feel better when I move. The other night I came home. I usually sit in my chair for about at least an hour after I get home. I'm tired. I need time to wind down, let my brain work, get rested up, try to shake off the stress of the day. And so my husband and I were watching TV, and we were there. I was there for about, I don't know, an hour, maybe even an hour and a half. I don't know. And finally I said, Bob, I can't sit here anymore. I've got to get up. So I went up and got up and cleaned my bathroom. Something to do, keep me busy. So anyway, all right. Well, you know what? Let me look up what mindfulness means. I want to talk to you about that a minute. I know kind of what it is, but I don't have a clear picture of exactly what it means. So let me look it up here in my handy dandy little portable computer, which is called a phone. All right, here we go. Mindfulness is the practice of purposely bringing one's attention in the present moment without evaluation, a skill one develops through meditation or other training. Mindfulness derives from sati, a significant element of Buddhist traditions, and is based on Zen and Tibetan meditation techniques. But we don't have to get into all that and say, oh my God, it's not of Jesus. Well, Jesus made all these people too. And it really is just, you want to just think about one thing, and it's really kind of clearing your mind out. Though the definitions and techniques of mindfulness are wide-ranging, Buddhist tradition explains what constitutes mindfulness is how past, present, and future moments arise and cease as momentary sense impressions and mental phenomena. Individuals who have contributed to the popularity of mindfulness in modern Western context, and it goes into what some of the people that I don't recognize any of these names. And since the 70s, psychologists and psychiatry has used mindfulness, and they've developed a number of therapeutic applications based on mindfulness for helping people experience a variety of psychological conditions. And so mindfulness practice has been employed to reduce depression, to reduce stress, anxiety, and it's used in the treatment of drug addiction. Programs based on mindfulness models have been adopted within schools, prisons, hospitals, veteran centers, and other environment and mindfulness programs have been applied for additional outcomes for healthy aging, weight management, athletic performance, helping children with special needs as an intervention during the perinatal period. So, there's a lot of evidence that says mindfulness may influence our physical health. And the psychological habit of repeatedly dwelling on stressful thoughts appears to intensify the psychological effects of the stressor. that just kind of makes sense, doesn't it? But studies show that if you mindfulness and you are mindful about relaxation and potential health properties and health exercises, good sleep, exercise, being kind, that those, research is showing that they can favorably influence the immune system. Well, isn't that something we all need right now with all this virus stuff going around? So mindfulness is just, something that we can use. I know they use it a lot in addiction, and people need to focus on the good and stay away from the bad and stop stressing, stop concentrating on stressors. All right, it's time for our first break. So when we come back, we'll talk about simple tips for fitness success. Don't go away. We'll be right back with more of Here's to Your Good Health. Hang on.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
Hi, and welcome to American Emerald Awards Foundation. What we do is we help individuals with autism, Down syndrome, and other mental disabilities. American Emerald Awards Foundation is a foundation that have residential homes where your loved one with autism and Down syndrome and many more syndromes can live 24-hour coverage. I am Norbert Brown Jr., President and CEO of American Emerald Awards Foundation for mental health. I've been doing this for over 40 years, and now we're about to branch all over the world. American Emerald Awards Foundation phone number is 1-800-217-8185. Happy holidays to all, and remember, mental health will save us all if we work together as a family. Thank you.
Today, some of the world's most advanced orthopedic techniques and technology are available right here in the Twin Counties at UNC Orthopedics at Nash. Our team of specialists offers a full range of orthopedic treatment, including spine services, hip, knee, and shoulder repair, as well as joint replacements and rehabilitation. So don't just live with the pain and immobility. The best care anywhere is close by. UNC Orthopedics at Nash.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
Welcome back. This is Here's to Your Good. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center. And I guess I've been doing this show for 7, 8, maybe 9 years. I don't know, quite a while. But so I imagine just about anybody or everybody knows who I am. But I love good health. I'm passionate about taking care of ourselves and being the best that we can be. And so you'll hear me say a lot of the same things. January always seems to be fitness month, getting healthy month. And we come off of the holidays and everybody feels bloated and fat because we ate grandma's pudding and Aunt Barbie's cheesecake. And so it's just time for us to get back on track. So I wanted to talk about some just simple tips to keep yourself fit. We need to stay in shape. It's just, we're made to move. God did not make us to sit in front of a computer and click on a mouse or play a game, exercising our thumbs. So we're made to move. And, in years past, before we had all the industrial, I got a call. How about that? Let's see if I can remember how to do this. Hey, this is Linda. How you doing? Hello? Hi. Can hardly hear you. What can I do for you? Hello? Are you there? Hello? I don't know if we had a bad connection or what, but caller, if you were having trouble, call back. We'll see if we can't get you through and be able to hear what you've got to say. All right, so, we want to have a sculpted body, but we don't want to give up our junk food. We don't want to stop watching TV. We don't want to get up and walk to the mailbox. We don't want to do some of the things that we have to do to make ourselves more fit. Oh, let's see if it works this time. Hey there, this is Linda.
Hello, this is Grant. Did someone call me?
No, you called me.
Oh, I'm so sorry.
That's okay. Have a great evening. Bye.
Are you?
All right. I guess it was a mistake. I don't know. Anyway, getting in shape doesn't have to be hard. It doesn't have to be laborious. It doesn't have to be a long time. It just needs to be where you can do a few things to make positive moves in your life that will impact you and make you feel better. So here's a couple of tips. Exercise daily. The goal is exercise for an hour. Well, I work full time. I get up. That's 5:30 in the morning. I go to bed at 9:30 at night. I get home about 5:30 or 6, depending upon. Last night I got home after 7. Tonight it will be after 8. And so I've been on the go all day. So exercise for me is not something that I can devote an hour to. I do it in increments, and I think that that's okay. You don't have to kill yourself jogging, running, You can do a little bit of a high-intensity workout if you want to. You can go for a walk at a brisk pace. You can jog a little bit. but be sure you don't get yourself in severe pain. And if your body is hurting, you need to stop. But you can march in place during a commercial on TV. You can make a goal to, like my goal is to be on the elliptical anywhere from 7 to 15 minutes a day. And like I said, it depends upon my time. Sometimes time gets away from me and I only have time for 7 minutes. But it's still 7 minutes. And if you add that 7 minutes with the time you're stepping in the commercials, they're 2 minutes apiece. And if you watch an hour show, well, that's another 6 minutes. And now we're up to 13 minutes of exercise, because it doesn't have to be 60 minutes at a time. It can be in increments. So, and you can do that. You can run to the bathroom or skip while you're cleaning your kitchen. I don't know, whatever you like to do that would make a little, put a little effort into you, that all adds up to be some exercise. And so, of course, we need to eat the right foods and we need to eat the right portions. A lot of people don't eat badly, but they always go back for seconds. None of us need seconds, especially if you get one of those big dinner plates. They're pretty big and there's a lot of food on those plates. So probably nobody needs seconds. I know if I make something that I really like, I will eat seconds, or I'll wait for an hour and then I'll have a little bit more. We don't need to do that. We certainly don't need to have a candy bar instead of an apple. Sugar is not going to help you get into shape. It makes you feel bad, you feel bloated, you get brain fog. It's just, there's nothing good about sugar other than the taste, and that it's very addictive. You can, sugar is more addictive than cocaine. So you just think about that. And if we need to do mindfulness to help with our addictions, sugar is definitely an addiction. It's not a illegal addiction, but it's an addiction nevertheless. So, you're just going to have to eat a lot of fruits and vegetables. That helps make your tummy full. Be sure you drink plenty of water, and drink some water before your meal. That helps fill your tummy up a little bit. And then, in order to have a good enough energy to even exercise, you've got to have good food, real food, whole food in your bodies. So, the best thing to do, and some people can do this, I do it, some people can't, and that's to eat 6 small meals a day, So drink a shake for breakfast and then have some peanut butter and celery, about 10. Every time you have a little snack like that, it's considered a meal. Then you might have a salad at lunch, and then at 2 o'clock in the afternoon you have an apple and peanut butter. Then you're hungry at 5, so you might have, some vegetables with ranch dressing, and then you eat a nice dinner. Stick to your lean meats. Seafoods are lean. Some seafoods have a lot of cholesterol in them. I personally love fish, and so I eat fish at least twice a week. I like salmon, I like shrimp, I like lobster, I like perch, I like crappie. I've got a patient that he fishes, and so he'll call me or he'll send me a text and say, got some fish, stop by on the way home from work. And so it's just really a blessing, because I love fish so much. But you want to make sure that you do have good protein, and you want to make sure that you portion what you're eating, so you don't, I tell my patients, to me it's a good example. When we go to the Italian restaurant, we're supposed to have a salad that's this big. And then when we have our pasta, it's supposed to be a small portion, and maybe a meatball or a piece of sausage or a piece of chicken. But what do? We have this huge plate full of pasta, this little itty-bitty salad, and then, of course, we have to have a cannoli or something for dessert. We're doing things backwards. And the portions have grown significantly. I don't want to share my age, but y'all know I'm old. But I remember back in the day, you know, when you asked for a glass of juice, you had a little glass that was about that tall and, I don't know, that big around. And that was a portion of juice for your breakfast. Now they give you a whole big soda glass just of juice. And what is juice? I mean, it's got an orange flavor or grape flavor, but it's primarily sugar. So you're better off eating the orange or eating the grapes. At least you get the fiber that goes with it. So, we just need to be mindful about what we're eating and watch our portions and think about it. And I've had to retrain myself. For a long time I ate very well, and I would grab a peach instead of a potato chip. Then, even after 5 or 7 years of eating pretty healthy, I fell back into I wanted the potato chips. I wanted this, I wanted that, instead of the bowl of fruit that was on my kitchen table. So I've had to retrain myself, and I'm in the process of that now. And I don't like it much, I can tell you. I'd much rather eat a sugar cookie than a couple pieces of pineapple, but I have to stop and think about what I'm doing. I have to stop and say, no, you don't need this cookie. The pineapple is going to be better for you. So it's not easy. You have to keep motivated. You have to keep yourself in a good mindset. You have to be positive. You have to push yourself away from the table. I mean, there's just all sorts of stuff you have to do. And it's hard to be disciplined. And sometimes you just want to say, oh, forget it. I just want to eat the junk. And you know what? Once in a while it's okay. But it's when we eat the junk more than we eat the rest of the good food that it's not okay. And that's what I'm talking about here. So we have to learn how to kick our bad habits. And, habits are tough. And there's a lot of them. There's some that we absolutely need to quit and don't even think twice about it. Smoking, drugs, unsafe sex, other unhealthy addictions. And I'm going to throw sugar in there. I see how people are so addicted. And I am too. I am not pointing any fingers because, if you point one this way, you got 3 coming back at you. And, we just have to we have to think about it, and we have to be cognizant about it, and we have to take the time and tell ourselves it's worth it for the healthy lifestyle. And then another thing you need to do is get your checkups. You need to see the doctor. I had a patient today. He's been at our clinic for a long time, but this is the first time I've seen him. He said, I don't mean to offend you, Doc, but I don't like doctors. Well, that doesn't offend me. I know a lot of people are afraid to come to the doctor. They're afraid to hear what the news is. They're afraid it's going to be bad news. I tell people, your labs are good, and they go, oh, I was so worried. Well, what are you worried about? I'm not going to knock you out because you have bad labs. But it's my job to show you what your labs are and to help you get out of that bad habit into a good habit. So, going to the doctor it shouldn't be a bad thing to do. There's things you need to do as well, self-breast exams if you're a lady, testicular exams if you're a fellow, if you need to look at your skin. If you got suspicious moles, you need to get them checked out. And you're going to find something wrong with you before I ever will. That's why I tell women and the men too, but I don't, they check different parts of the body than women do. But, just check your breasts every once in a while in the shower. The only thing, if you're a menstruating woman, don't do it around your cycle because our breasts get lumpy at that time and they get very sore. So that's not a good time to do a breast exam. But you've got 3 weeks out of the month that you can. So just every once in a while in the shower, when you're soaping yourself off, examine your breasts. Guys can do that with your testicles when you're in the shower as well. And of course, we've already talked about sleep. We know it's good for us. It affects our metabolism, our mood, concentration, memory, motor skills, stress, immune system, and cardiovascular health are all affected by lack of sleep or by good sleep. Our body needs to sleep to repair, heal itself, rejuvenate itself, and those are things that our body cannot do when we're awake. All right, it's time for our next commercial, so don't go away, and we'll be right back, and we'll cap off this evening. Hang on, I'll be right back.
At Downey's Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Downey's Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Downey's Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Today, some of the world's most advanced orthopedic techniques and technology are available right here in the Twin Counties at UNC Orthopedics at Nash. Our team of specialists offers a full range of orthopedic treatment, including spine services, hip, knee, and shoulder repair, as well as joint replacements and rehabilitation. So don't just live with the pain and immobility. The best care anywhere is close by. UNC Orthopedics at Nash.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
All right, I'm back. We've been talking about things to do to get fit. We've talked about exercise. I don't think there's anything more to say about that. We've talked about eating fresh. You know, fresh fruits, vegetables, whole grains are really important. That should be the main part of your diet. Lean sources of protein, fish, tofu, beans, Chicken is okay, you know. Beef is just pretty fatty. We love beef. We're a beef-eating country, and I buy a quarter of a beef or an eighth of a beef or a steer every year from a friend of mine who raises them, and you know, we do eat. I love a good steak, but that can't be what you eat 5 nights a week. You know, you need to have variety, and so, you know, I try to limit my steaks to 1 or 2 a month. Sometimes I eat more, sometimes I don't eat any at all, just depends. But anyway, we don't want to, we want to eat snacks that are fruits, vegetables, nuts. We want to avoid highly processed foods. That's part of our problem in this country, is all the processed foods we have, and it makes it so easy and so convenient. And hey, I'm right there with you when you say, I've worked all day, I don't want to cook. Excuse me, I've been drinking water. I don't know what the heck. But what you just have to figure out a way that you can cook for most of the time. Now I cook on the weekends. Excuse me, I eat cook 2 or 3 meals, and then we eat off of that during the week. I don't mind leftovers. Some people don't like leftovers, but I do not have the energy or the time to come home and cook very often. So, and I like to, you know, I've already got my menu planned for what I'm going to cook this weekend. So, but processed foods are really bad. They have a lot of artificial sweeteners, artificial coloring. There's lots of salt in them. There's excess fat in them. So we need to really stay away from that as much as possible. And of course, it's important to eat breakfast every day. Some people, like I can't eat first thing in the morning. I always cart my breakfast to work with me. I start eating about 8:30. I just can't eat first thing in the morning. When I get up first thing, I want to have a cup of coffee or 2. That's my routine. I love coffee. I'm a coffeeholic. So I don't know if that's good or bad. You know, coffee, they say, oh yeah, it's great for you. Oh no, it's terrible for you. Oh yeah, it's okay. It goes back and forth like a tennis ball. But I like coffee, and I drink a lot of coffee. But, you know, a good healthy breakfast gives you the energy and fuel you need for optimal mental and physical performance. So, you know, we want to maintain our stable blood sugars, and that will help us maintain a better weight. And of course, drink. Water, 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 and more water. And bottled water is not the best, only because it's plastics, and that plastic can leach into the water and go into your body. So the best water is, personally, I have well water, but I drink out of my tap. But water is still, you know, the best that we can do. We're 65% water. We need to put that much in our bodies every day. That's why they'll say 64 ounces of water a day. And you know, if you drink all the water you're supposed to, you're not going to want soda, which is terrible for you, both diet and regular. I'd almost regularly see you drink the regular soda. Doesn't have quite as many chemicals in it as the artificially sweetened sodas do. So I don't think diet soda is a great idea either. Now, do I drink a diet soda? Sure I do. I might drink, I don't know. I don't drink soda very often. I probably don't even drink one a month. But you know, you can have a soda every once in a while, but just be sure that you get your water in. And of course, this is a big one, and especially in these days, everything is so chaotic in our world, and so everything seems so topsy-turvy and upside down. But we've got to learn how to reduce our stress. And reducing our stress, you know, if we don't, we can get heart trouble, we can get digestive problems. I can't tell you how many people have had, they think they're having a heart attack or they're short of breath, and it's anxiety that is plaguing them. So we need to learn how to manage stress. Exercise is a good one for me. That's what I do. I like to exercise, and it's a good stress reducer for me and for other people. If you like to read, spend 20 minutes a day reading a book of your choice, whatever you prefer. Meditate, take a walk, enjoy nature, go dig in the garden, whatever you like to do. Everybody's got hobbies. Maybe you like to crochet or knit or do crafts. Do that. Hobbies that will keep your fingers busy and your mind busy, and it's just good for you. And then, we need to take some breaks. We need to have some vacations. You need to have some days off every once in a while. We can't work all the time. Even if our bosses want us to, we can't. We need to have a break from that too. And we can't bottle up our emotions. We've got to let all this stress out. We've got to let the emotions out. We can't have them causing physical symptoms because we're not voicing our opinions. And if you've got an issue with a family member or you got an issue with a loved one, you just need to talk to them. You don't need to scream, holler, accuse. Just say, this is how I feel, and talk about it. But bottling up your emotions is a terrible thing to do. We need to learn how to focus on our feelings and discuss our feelings. And, we need to maintain consistency and moderation in our lives. Anything is okay in moderation. A glass of wine is great in moderation. A bottle of wine is too much. That's just a bite-sized piece of candy. If you got a sweet tooth, is okay. The whole candy bar is not. We just have to, look at the big picture and what we want to go for, and we have to make changes, and probably do them one at a time. I tell my patients, how do you eat an elephant? One bite at a time. If you look at the whole elephant, you're going to say, I could never finish that. That thing's humongous. Or I could never lose 20 pounds. That's just way too much. But if you take a small little step, they're called Kynan steps, small, tiny little steps, and you just start with one step and you accomplish that goal, and then let's say you want to reduce your soda and increase your water. That's a goal for you. That's a small step. So what do? Well, instead of drinking 4 sodas a day and 1 glass of water, let's drink 2 waters and 3 sodas. Don't give it up all at once. You've got to decrease it gradually. You've got to realize in your mind that you're going to make a change. You're going to get to a goal. And so then when you get to the point that you have, wow, I had almost all water today. I didn't even drink a whole soda. You've met your goal. Once you've got that and you feel like you've got that as more of a habit now than really having to think about it, then it's time to go on to another goal. Let's say you want to reduce your beef intake, or you want to reduce your eating out intake. So instead of eating fast food 5 days a week, let's cook something one day or over the weekend and bring that to lunch for lunch instead of going out and getting a burger. And then you can start doing small little things like that. We can't jump in and do it all at once. We're not built that way. We can't do it that way. We don't feel right that way. And when we take these habits and do it slowly, then it just becomes part of your daily routine. It becomes part of your health goals. So avoid extremes, whether it's exercise, whether it's food, whether it's vacationing. We have to do it all in moderation. And as we go in moderation, then we learn and it becomes habit for us. So that's all I've got today. Let's see, I got one more article. What's this got to say? Well, it's talking about physical fitness. And one thing I didn't talk about before with physical fitness is you have a decreased risk of injury, because you're increasing your flexibility, your muscle strength, your stability, your bone density. If you've got osteopenia or osteoporosis, you need to be walking every day because walking helps build up those bones. And of course, it helps with your mental health. We talked about that. And it can even help reduce some problems like cancer, type 2 diabetes, helps you manage your weight, and we want to do all of those things. So I guess that's it. Nobody's got a call, so I'm going to say goodnight for the evening. It's been great to be with you. I'm going to be having several guests come on for the next few weeks. I'm excited about that. I don't know who any of them are yet. It's always a surprise around here. So you all have a great evening, and I will see you next week with more of Here's to Your Good Health. Good night.